We are at Altona Farm, about 40 kilometers outside of Cape Town. This is where the Ministry of Health in the Western Cape is here to sort of ramp up their vaccination drive to come and vaccinate people who live in the outer, peripheral and outskirts areas. Those are farm workers. In the past a few weeks, the Ministry of Health is also looking to ramp up its vaccination drive to make sure that they vaccinate as many people as possible, looking to vaccinate at least 1 million in the next week or so. Just to give you a bit of a background about the farming industry here in the Western Cape, it forms an integral part of the economy and also the socio-economic space here in the Western Cape. People who live in the farming areas also are faced with challenges such as housing, and a research which was published earlier this year found that over 2 million people were displaced and also evicted from their homes. So they do have those challenges of human rights violations in the farms. So the health ministry is here to make sure that they restore some of those human rights. But we'll be speaking to the Minister of Health in the province, French Mombo, to tell us more about their vaccination drive here and what informed it.
Indeed, farm workers, they are also part of the group that are vulnerable, and also the issue of the accessibility of the vaccination is part of it. As you indicated, that is also in the remote areas. But the other part is about the access to, in terms of the registration. Probably you might have noticed that there is not even much of the network that is here, but also they don't have access, some of them, on the correct devices. So that's why we have to go out and reach out for them. For today, we will be vaccinating about 200, and then we'll be moving also to the other farms, the adjacent farms. So it's farm to farm where we ask permission. Last week we have been also targeting other farming areas, but also take into consideration that they are seasonal workers. That's why we're using J&J here instead of the 2-dose Pfizer, because there's no guarantee that they will be able to come for the second dose, or they might not be around. They might be done probably with their contract. So that's why it's issues. As we always say, that we leave no one behind, because the more you are part of the vulnerable community or population, the higher the chances of you having a severe illness or even death when you contract COVID, and then now you ended up, because of the issue also about the access to the health services. That's why we brought these buses. These buses, normally we use it for the school bus. I think we've got about 7 or so, which others we use it for the remote areas, for the primary school, for the teeth, dental, eye care for the primary school. But now we're using for such, because the clinics are furthest. So inside the bus, you can get about 2 consultation rooms. But luckily, the farmer gave us one of the this kind of the accommodation, so that we can have even some of our gazebo, so that we can vaccinate as many, and from here we go to the others. So that's why we're saying that people mustn't feel like they have been left behind. We will go to them. Where there are human beings, there will always be us. But generally with the healthcare workers, with the farm care workers, it's also about the lack of transport, because even like there is a clinic here at Durbanville Community Day Center, but it's quite furthest for people to go there. So that's why we take this bus and go from farm to farm, so that we could be able to reach out as many as we can.
Such an interesting initiative, ma'am. And also, just to give us and put up to speed and give us an update, how far are you now with the vaccinations, and what is your target plan from now?
Last Friday we had about 961 that have been vaccinated. I don't have the figures for Saturday, because we started to roll out also more of the sites for Saturday. We are targeting, at least we'll be done, we have 1 million by the end of this week.